Many people take calcium every single day for one reason: stronger bones. It sounds harmless, it sounds healthy. But here is the twist that most people never hear. The same calcium that is supposed to strengthen your bones can actually end up hardening your arteries. Yes, the mineral that protects your skeleton might quietly contribute to plaque buildup in your blood vessels. And the shocking part is this: the problem is not calcium itself. The real issue is what the body does with it once it enters your system. Calcium is essential. Every heartbeat, every muscle contraction, every nerve signal uses it. But calcium is also stubborn. It does not move by itself. It needs guidance, it needs direction, and when that guidance is missing, calcium can go to the wrong places. Instead of strengthening bone tissue, it can settle inside your arteries, layer after layer, year after year, turning flexible blood vessels into stiff, narrow, rigid pipes. Doctors call this vascular calcification, but most people only notice it when it becomes a serious threat. This raises a huge question. Why does the human body sometimes send calcium to the wrong place? Why does calcium leave the bones and end up in the blood vessels? The answer leads to a nutrient most people barely talk about: vitamin K2. This vitamin acts like a traffic controller for calcium. It activates special proteins that move calcium into the bones and keep it out of the arteries. Without enough vitamin K2, those proteins stay inactive. They cannot protect your blood vessels. They cannot guide calcium safely, and that is when the trouble begins. Calcium drifts around with no regulation. It may settle into artery walls, forming hard deposits. These deposits make arteries narrower and less flexible. Over time, this process increases your risk of plaque buildup, heart strain, and serious cardiovascular problems. You will rarely hear this connection discussed in simple words. Many people think heart plaque comes only from cholesterol, sugar, or fats. But research shows another layer to the story, a layer that has been hiding in plain sight. Calcium without proper direction can be dangerous. Vitamin K2 is the missing piece that determines whether calcium becomes your protector or your enemy. In this video, we are going to break down this entire process in clear, simple language. You will learn why calcium behaves the way it does. You will learn how vitamin K2 controls the final destination of calcium inside your body. You will see how the lack of K2 may cause calcium to leave the bones and build up inside arteries. And you will discover why so many people are taking calcium supplements without understanding the hidden risks. You will also learn the lesser-known science behind how vitamin K2 activates specific proteins like MGP and osteocalcin that control calcium transport. These proteins are the body's own defense system against artery calcification, but they only work when enough vitamin K2 is present. This is something most supplements never mention. Stay with this video until the end because the final part will show you how to balance calcium and vitamin K2 safely, how to support strong bones without increasing the risk of hardened arteries, and how to protect both your skeletal system and your heart at the same time. This information is rarely explained, yet it affects almost everyone who takes calcium or cares about heart health. Many people have been told to take more calcium for bone strength, but very few have been told that calcium needs partners. It needs vitamin D for absorption. It needs magnesium for balance, and it needs vitamin K2 to make sure it does not end up in your blood vessels. When one of these nutrients is missing, your body pays the price. The effects are silent, slow, and dangerous. But the good news is that once you understand the calcium K2 connection, you can take simple steps to protect your health. By the end of this video, you will know how to stop calcium from becoming part of plaque. You will know how to support your bones and your arteries at the same time. You will know how this overlooked vitamin shapes the future of your cardiovascular health. And most importantly, you will understand the science in a way that feels clear, simple, and practical. Welcome to our channel. If valuable health information like this helps you, make sure to subscribe so you never miss our upcoming videos. Calcium plays many roles inside the human body. Most people think of it only as the mineral that strengthens bones and teeth, but its responsibilities go far beyond that. Every heartbeat relies on calcium. Every muscle contraction depends on it. Even the signals that move through your nerves use calcium as a messenger. It is one of the most active minerals in your entire system, constantly moving, constantly being used, and constantly being replaced. Because of this, your body must keep calcium under strict control. Your bones are not hard, dead structures. They are living tissues that rebuild themselves every day. Old bone is broken down and new bone is formed in a non-stop cycle. For bones to stay strong, calcium must be delivered into the bone matrix and locked into place. That means the body needs a way to move calcium out of the bloodstream and into bone tissue. But this process is not automatic. It depends on a group of proteins that act as carriers, guides, and stabilizers for calcium. This is where vitamin K2 enters the story. Vitamin K2 is a fat-soluble vitamin that works very differently from the more familiar vitamin K1. Vitamin K1 mostly helps blood clotting. Vitamin K2 has a completely separate job. Its main purpose is to activate the proteins that control where calcium goes inside your body. Without K2, those proteins stay silent and inactive. With K2, they switch on and begin guiding calcium to safe places. Two of these proteins are especially important. The first is matrix GLA protein, often called MGP. Its job is to keep calcium out of places where it does not belong, especially soft tissues like artery walls. Active MGP acts like a shield. It prevents calcium from forming crystals inside blood vessels. The second protein is acetylcholine. Acetylcholine takes calcium and binds it into bone tissue. When this protein is activated by vitamin K2, it becomes a powerful tool for bone strength. If vitamin K2 is missing, both MGP and acetylcholine remain inactive. They cannot do their jobs. Calcium may float through the bloodstream with no proper direction. It may fail to enter the bones. It may start settling in soft tissues. And that is where the quiet danger begins. When calcium levels are high, but vitamin K2 is low, the body loses its ability to control where calcium ends up. Calcium continues to circulate in the blood, but without enough K2 to activate the proteins that guide it, much of that calcium is left unmanaged. When this happens, the mineral does not always go to the bones. Instead, it can begin settling in places where it does not belong. One of the most concerning locations is the inner layers of blood vessels. This can happen slowly and silently, especially in people who take large amounts of calcium from supplements or consume high calcium diets without balancing nutrients. As unmanaged calcium begins to collect in arteries, it forms tiny mineral deposits. Over time, these deposits grow and embed themselves within the intima and media layers of the blood vessel walls. This process is known as vascular calcification. It is not a simple coating on the surface of an artery. It is a deep structural change. Calcium crystals stiffen the vessel walls from the inside out. What should be smooth, flexible tissue gradually becomes rigid and less responsive. Arteries are meant to expand and contract with every heartbeat. That flexibility allows blood to flow smoothly. But when calcification sets in, the arteries lose this ability. They become harder, tighter, and more resistant to the natural movement of blood. This increases the workload on the heart, which now has to push blood through vessels that no longer bend easily. Over time, this can raise blood pressure and strain the cardiovascular system. As the deposits grow, they can also combine with fats, inflammatory cells, and other materials. This mixture forms what is known as plaque. When calcium is part of the plaque, the structure becomes even more solid and dangerous. These calcified plaques can narrow the arteries and reduce blood flow to vital organs. If a plaque becomes large enough, or if a piece breaks loose, it can block circulation entirely. This greatly increases the risk of heart attacks and strokes. The presence of calcium inside these plaques makes them more stubborn and more difficult for the body to manage. Vitamin K2 plays a central role in deciding what calcium does inside the body, and it works through a very specific biochemical process. One of the most important actions of vitamin K2 is enabling the carboxylation of matrix GLA protein, often called MGP, as well as osteocalcin. Carboxylation is a chemical activation step. Without it, these proteins remain in their inactive form. When vitamin K2 is present, it adds the needed carboxyl groups to these proteins, switching them on and allowing them to carry out their functions. Only carboxylated or activated MGP can block calcium from attaching to blood vessel walls. If MGP stays inactive, calcium can settle in arteries with little resistance. Once MGP is activated by vitamin K2, it becomes one of the body's strongest natural defenses against vascular calcification. Active MGP binds to free calcium and prevents it from forming crystals inside vessel walls. It acts like a protective shield, stopping calcium from attaching to soft tissues. At the same time, osteocalcin, also activated by vitamin K2, helps move calcium into bone tissue, where it can strengthen the skeleton. Together, these two proteins maintain a balance. Calcium is encouraged to stay in bones and discouraged from entering arteries. When vitamin K2 levels are low, this balance breaks down. Calcium loses guidance, and the risk of unwanted deposits rises. This is why taking calcium alone does not guarantee stronger bones and may even contribute to calcification elsewhere. The relationship between calcium and vitamin K2 is sometimes called the calcium paradox. The paradox describes a situation where people may have too much calcium in their arteries while having too little in their bones. The real issue is not the amount of calcium, but how well the body can direct it. With enough vitamin K2, the body can send calcium to the right places. Without it, calcium behaves unpredictably. But vitamin K2 itself comes in different forms known as menaquinones. Among them, MK7 is particularly important. MK7 has a longer half-life in the body, meaning it stays active in the bloodstream for a longer period. This allows it to keep activating MGP and osteocalcin more consistently. Because of its stability and bioavailability, MK7 is often considered one of the most effective forms of vitamin K2 for controlling calcium movement. Research over the past decade has brought a growing amount of attention to the relationship between vitamin K2 and vascular health. Several studies and reviews have reported that higher vitamin K2 intake is linked with lower levels of vascular calcification and reduced arterial stiffness. These findings come from both observational research and controlled trials. Many of these studies point toward a protective effect, showing that people with better K2 status tend to have more flexible arteries and fewer signs of calcium buildup in their blood vessels. A notable piece of evidence comes from a meta-analysis that combined data from multiple clinical trials. In this review, researchers observed that vitamin K supplementation, including vitamin K2, significantly slowed the progression of coronary artery calcification. Coronary artery calcification scores are one of the most reliable markers used to assess long-term heart disease risk. Slowing the rise of these scores suggests that vitamin K2 may help reduce or delay the hardening of arteries caused by calcium deposits. This type of research supports the idea that activated MGP fueled by vitamin K2 can help control calcium movement in ways that protect the cardiovascular system. However, not all studies point in the same direction. Some newer research published in recent years has shown more limited effects, especially in certain groups. One study focusing on older men found that vitamin K2 did not slow the calcification of a specific heart valve. This serves as an important reminder that different types of calcification may respond differently to supplementation, and that age, health status, and underlying conditions may influence results. While the overall trend of evidence is encouraging, it is not uniformly conclusive. Many scientists argue that more long-term, high-quality trials are needed to determine exactly how effective vitamin K2 is in preventing calcification in different parts of the cardiovascular system. Research so far has produced strong signals, but not all questions are answered. One consistent finding, however, is that people with cardiovascular disease often show lower levels of vitamin K2 forms such as MK4 and MK7 in their blood. This pattern suggests that deficiency may be common among individuals with arterial stiffness or calcification, pointing to a potential connection between low K2 status and poor vascular health. For anyone who uses calcium for bone health, the information about vitamin K2 has very real everyday meaning. Many people take calcium supplements because they want stronger bones, especially as they age. Others increase calcium through diet, believing that more calcium automatically supports both bone strength and overall health. But calcium does not work alone. Without the nutrients that guide it, calcium can end up staying in the bloodstream longer than it should, and that increases the chance of it settling in blood vessel walls. This is why understanding the role of vitamin K2 becomes so important for ordinary people who rely on calcium for long-term health. If you are someone who takes calcium supplements, it may be helpful to make sure your vitamin K2 intake is not low. Vitamin K2 acts like the supervisor that tells calcium where to go. When the body has enough K2, calcium is more likely to enter the bones, which is where it is needed. When K2 is missing, calcium does not receive that direction, and some of it may settle in arteries instead. This means that supporting your K2 levels is one of the simplest ways to help your body use calcium correctly. You can also increase vitamin K2 through certain foods. K2 is found in fermented foods, some cheeses, egg yolks, and animal-based products. But many modern diets do not include enough natural sources of K2. In this case, a vitamin K2 supplement may help, especially for those who already take calcium or those who eat very few K2-rich foods. Getting enough K2 does not remove calcium from the diet. Instead, it supports the safe and efficient use of calcium inside the body. This is especially relevant for older adults because calcium use becomes less efficient with age. Bones lose density, arteries stiffen more easily, and the balance between calcium and guiding nutrients becomes more delicate. People with heart risks or family history of cardiovascular disease may also benefit from paying attention to their K2 intake, since mismanaged calcium can add unnecessary strain to the cardiovascular system. Even people who do not take supplements but consume high calcium diets can face similar issues if their vitamin K2 levels remain low. For everyday viewers, the message is simple. Calcium is important, but its benefits depend on whether the body can move it to the right place. Vitamin K2 plays a central role in this process, guiding calcium into bones and keeping it away from blood vessels. Understanding this balance can help support both bone health and artery health in daily life. Even though vitamin K, thus, has become a popular topic in conversations about artery health and calcification, the research behind it isn't as clear-cut as many people assume. Some studies do suggest that K, thus, may help slow down or reduce calcium buildup in blood vessels, but other studies don't show the same level of benefit. This inconsistency becomes even more noticeable when calcification has already formed. Once the arterial plaques become hardened with calcium, they behave more like mineral deposits than soft, reversible buildup, and reversing that process is extremely difficult. So, while KDAS might play a role in prevention, it's not guaranteed to undo what's already there, and this is where a lot of confusion comes from. Another key area researchers are still trying to understand is dosage. Different studies use different amounts, and the results vary widely. Some trials use high doses of MK4, while others use much smaller amounts of MK7. The body also handles these forms differently. MK4 tends to be short-acting and needs to be taken more frequently, while MK7 stays in the blood longer. But that doesn't automatically mean it's better. Scientists are still trying to figure out which form is more effective for directing calcium away from arteries and toward bones, and whether different groups of people might benefit from different versions. There's also the question of long-term safety and consistency. Most studies are relatively short, often just a few months or a couple of years. Artery calcification, however, is a slow process that happens over decades. Without long-term data, it's hard to predict how K supplementation will affect different individuals over a lifetime. Factors like genetics, underlying health conditions, medications, and diet all influence how someone responds. Because of all these variables, the science is still evolving, and researchers continue to investigate how K-sucker fits into the bigger picture of cardiovascular and bone health. Calcium will always be essential for strong bones, but what truly matters is how your body uses that calcium. Without the right support, especially from vitamin K, calcium can end up in places it doesn't belong, including your arteries. K-thol plays the quiet but crucial role of directing calcium into your bones, where it strengthens, instead of allowing it to drift into blood vessels, where it can harden and cause problems over time. When you think about bone health, it isn't just about taking more calcium, it's about balance. Calcium together with vitamin K gives your body a much better chance of building strong bones and keeping your arteries flexible and healthy. That balance becomes even more important if you rely on supplements or if you're older, active, or simply trying to support long-term health. So as you reflect on your diet and your daily habits, consider whether calcium is getting the full team it needs. Maybe it's time to rethink not just how much calcium you take, but how well your nutrients work together. Vitamin K, though, deserves more attention than it gets, and understanding its role could be a simple shift that supports both bone strength and cardiovascular health. If this video helped you understand the bigger picture, hit like and subscribe to our channel for more simple, science-based health insights. Your support helps us create more content that makes health easier to understand and easier to apply.